How was your hearing over the holidays? Well, it can be hard to hear with lots of loud loved ones if you repeatedly requested that they retell their tales or you found it hard to follow the family's conversation. It may be more than just rowdy relatives. Dr. Catherine Henry is here to turn up the volume on verifying hearing loss. Dr. Henry is an ear, nose, and throat specialist with MetroHealth. Welcome to the show.
Thanks for having me, Lori.
Is hearing loss just inevitable?
Well, it is common as you get older, but it's not as inevitable as needing reading glasses or bifocals. I have patients in their 80s and 90s that I see for other things whose hearing's perfect. And it usually starts in the 50s and 60s, although you might not notice it until later. And it can start even earlier if you already have some noise damage from exposure to noise.
Okay, so what does that mean? How is that different?
Well, both noise damage and age-related hearing loss are in the higher tones, although they look a little different, so it just all adds up. It's like adding insult to injury. So it's really important when you're younger to protect your ears from loud noises such as firearms, machinery, power tools, super loud music. And if you can't avoid it, you want to use hearing protection that's appropriate for the kind of noise you'll be in.
Okay, so for those with age-related hearing loss, what kinds of symptoms should we be looking for?
Well, the most common things is that you can't hear clearly and you have to ask people to repeat. Like you're not sure if they said park or part, park or bark. A lot of people have trouble on the phone, especially mobile phones, battles over the volume on the TV. Often you'll have ringing or other kinds of noises, hissing in your head. And a lot of times you may think you're fine, but your family,
they notice the difference.
They're willing to point it out to you.
So it's time to check things out then.
Yeah, and it's really common because it's a high frequency loss. It's usually harder to hear women's voices and kids' voices than men's voices, which is why she can hear him, but he can't hear her. And another thing to look out for is you can't forget something you never heard. So sometimes hearing loss gets confused with whether someone has a cognitive impairment. And if there's an issue there, you want to be sure to check somebody's hearing to make sure that they're just not missing stuff.
Okay, so should everybody just have a standard hearing test at some point?
Well, there's no agreement on when or how often hearing should be checked because there isn't any good proof that finding it before you notice it really changes anything. But if there's any question, usually the first step is to see your primary care physician, have them take a look in your ears, make sure it's not something simple like earwax or fluid in your ears. If you have earwax, that's more common as you get older and it's pretty easy to get rid of. And I've saved a few families for over the holidays.
So what if you go to your doctor and they say your ears are fine, but you still have some problems going on?
Well, then you should have a hearing test, and that's performed by an audiologist who's a professional specializing in hearing testing and treating, fitting hearing aids. And if you have a kind of hearing loss that can't be corrected with some kind of treatment, like an ear infection or something, then you have to consider things like hearing aids. So usually you'll get the hearing test and then you would see an ear, nose, and throat doctor to figure out what to do about the hearing loss that's been diagnosed.
Okay, you've gotten some great information out here for our viewers, so hear. Let's all hear better in the new year. And for help, use the information that's coming up next. My thanks to Dr. Henry for allowing us to hear her out about this important information.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next.